All right, guys, we're gonna go over the flossing technique specifically for the knee. So great technique to use if you are in some knee pain, knee discomfort, tightness, anything of that sort. So we're gonna go ahead and use our floss. And a couple things before we start is the way floss is working is via fascial glide. So we want to draw some compression over our skin and push those fascial layers together so they can glide and open up. Now, in terms of how much compression we want, we're gonna go for about 50% stretch. Okay, so if this is 100%, as far as I can draw this band out, halfway there is about 50%, okay? So how we're gonna start this up is I'm just gonna apply this here to the top of my knee. I'm going to wrap it under and then overlap so it sticks, all right? And then from there, I'm gonna go ahead and just start wrapping it. I'm gonna overlap halfway each time. Again, I'm applying about 50% stretch here, wrapping over the knee, over that joint, like so, until I kind of run out of real estate here with the band. And then I'm just gonna go ahead and tuck it back under here, okay? So first things first, we gotta move. So we're gonna start with some open chain motions. Just gonna lift that leg up. We're gonna flex and extend the knee. Okay, open chain meaning that foot is off the ground. Okay, go for about 30 seconds to a minute here. Now we don't wanna wrap that floss so tight that you're losing circulation in the toes or anything like that. So if you are, you can take it off and do it a little bit lighter. And then we're gonna go ahead into some closed chain motions. So that could be whatever you're having pain with in terms of the movement. So maybe it's a squat. So you could go in and work on actually squatting with this on. You could work on lunging. Okay, this kind of thing. If that's too intense for you, you could come into a half kneeling position, drive into the knee like so, change up a few different angles. Right, again, nothing that's gonna cause you pain. And you do that for about another minute or so, and then we're gonna go ahead and pop this guy off. Okay, we're gonna try to limit to 2 minutes or less having that compression on there. And then you're gonna wanna go in and retest. So whatever test you decided to use for your knee discomfort, pain, tightness, range of motion, you would then go in and retest it. Okay, so if that was a lunge or a squat, if that was sitting back onto your heels, retest. We want to know, did this modality work? If it didn't, there's no use redoing it. If it made it worse, there's no use redoing it. If it made it better, definitely a reason to redo it, okay? So try that out, see how it goes.